Good morning, everyone. We're all gathered here, and we're going to start on time today because we have a lot of ground to cover, and I'm sure that we'll have more people joining. I see people rapidly joining, but they can catch up or listen to the beginning part of the webinar if they have missed it. And as soon as I can advance the slide some way, we will start. There we go. All right. Welcome to day 40. I don't know about you guys, but it seems like about at least 6 months for me. Jim's nodding next to me. We've actually been here more than 6 months, but this last month has aged us greatly. It's been pretty intense.
I can't look any older.
So, but thank you, and we'll go into more. But thank you everyone for your patience and rolling with all of the hiccups, the numerous hiccups with equipment, IT, Metasked, et cetera, space, et cetera. But for the most part, I think people have been tremendous, and we thank you for that. So here's what we're going to cover today. Incident reporting, billing and 731 checklist, healthcare choices, HR recruitment efforts, the IM assessment, training tools, shout outs, congratulations, and more. Okay, so incident reporting. I'm going to go over this pretty quickly. Everyone has hopefully gone through the training on this. We had a training, I believe it was our second week that we launched, and if you need some additional support, Lisa Getman, our VP of Corporate Compliance, is more than happy to make sure that you can get that, as well as our training department. But just a couple things, because we had our first meeting to review July incidents, and we were way under where we think that we should be, given the number of individuals that we support. So just to reiterate, when you observe or become aware of an incident, it is your responsibility to report that. You must contact the agency that's supporting the individual, especially if it's a residential, so you make sure that they're aware of what's going on. You must call the Justice Center if that is applicable, and it is applicable if it meets the criteria of the Justice Center. You are mandated to report it if it meets that. You need to email incidents@caredesignny.org and CC your supervisor. People are doing a good job of they're emailing incidents@caredesignny.org, but they are not including their supervisors, and that is really important. And then you also must complete a case note in Metasked, which includes your follow-up actions. I've included here again the mailbox, the cell phone for Lisa Getman. And if you have any questions, need additional support, please reach out. Unfortunately, we do not have a particular module within Metasked for incident reporting, but Lisa is going to work on a template that she will put on the M drive so that the next slide that I'm going over kind of talks about what you should be reporting: person's name, date and time, location, date and time you became aware, description, referrals, and actions. All of those things we're going to put on a template so that you can answer that and make sure you are completely sharing the incident that has occurred. And then you can copy and paste that into your Metasked note and copy and paste that into your email notification. That should make things a little bit more streamlined for everyone. So just a reminder on your responsibilities of reporting incidents. Okay, so next, we're going to turn it over to our finance department to talk about some of our billing and documentation highlights for July. Charlie and Venkat, are you on the line? Well, then we will have Jim step in and run the show for us until they join us.
All right. I guess I should have been prepared as Plan B. So this is a report that comes out of Metasked that looks at the number of individuals that each care manager is supporting and it looks at that number compared to the number of individuals for whom the care manager has billed as of a point in time. So this report can be run at any point in time during the course of the month or after the month. Looks like somebody's trying to dial in. So we look at it kind of weekly, and from this information, I don't know who's on the line. Somebody's punching numbers.
Please enter your audio PIN followed by the pound or hash sign. If you
Who's ever trying to dial in, please mute your phone line.
There we go.
Please mute your phone line.
You want to tell people to, there we go.
Try again.
Maybe. All right. So again, please mute your phone. Somebody's phone is live. Please mute your phone. So in this example here, in a week, as we look at this in a weekly period, it shows that after, in this particular example, 10 individuals were billed for in week 1, 15 in week 2. The report would show 25 individuals that we've billed for on a particular individual's caseload after week 2. So the report, we kind of just track what's going on by care manager, assuming the report is functioning properly, which is always a challenge with some of the reports that are coming out of Metasced, is they don't truly reflect necessarily what actually has been, in this case, billed for each care manager. So some of this we know has been a challenge in trying to identify issues with the reports, but if this report is working properly, that's what the report would be showing. And from that, we develop what's the percentage, obviously, that, again, please mute your phones. Somebody's continuing not to mute their phone. So from that, we get a percentage percentage of people that you've submitted an activity that has been audited and approved to move to billing versus your total number of people you support.
Oh, sorry.
It's okay.
Jim, Ben and Charlie are on the phone, just so you know.
Okay, great. So I'm going to turn it over to you guys. So we just did that first slide. So we'll advance it to the next slide. As soon as Ann is able to, there you go. So from there, in terms of going over the report.
Yes. Hi, I'm Charlie Kajacek. I'm the Vice President of Finance, and Jim went over the first slide on the Care Manager Progress Report summary, and he went over the numbers and how that we calculate the realization percentage. And I'm going to turn this over, this particular grid, to Venkat Appanna, who's our billing manager. And I just wanted you to know that the progress report is the source data for this grid. So,
Hey, Charlie.
Yes.
You need to turn off your Surface so it's not broadcasting through that, because you're echoing very badly.
Okay, it's off on the Surface. So, how's that? Any better?
Perfect. Much better, thanks.
Okay, great. So I'm going to turn this over to Venkat Appanna, our billing manager, to go over the grid.
Hello, everyone. Good morning. Basically, the way how we compile these numbers on this grid is that we took all the members in coordinate, and we got the care coordinators for them. That would give us the 26,031 that you see for member counts. And for those care coordinators, we looked at to see how much billing they did. So for July, the total billing in terms of claim count was 22,065. And we try to match the billing data with the member count. And we came up with a ratio of members billed compared to the caseload for each care manager. And from there, the percentage that we got, we grouped them, the percentage by bands, and you'll see the bands 0%, 1 to 24, and so on. And within those bands, we count how many care managers are within those bands. For example, for 0%, that means 0 billed. There were 7 care managers that didn't bill anybody, and the count of members was 27. The next band, 1 to 24%, we have 24 care managers that had member count of 672, and they only billed 85. So right next to that, you'll see members not billed, it's 587. And so on and so forth. Also, we put down members who are not assigned, and that's 681 as of the last analysis that we did. But we did bill for people, at least from the billing file, and we billed 384. Out of those 681, we still have 297 that still need to be billed. At the end of the day, for July, we still have not billed for approximately 4,000 members, or at least on my end. That does not mean that work was not done. So as you guys know, there's been some billing issues. We had about, the last count, about 2,900 claims that were still stuck in the queue waiting to be approved. So I'm speculating some of those are July billing. As we process billing, we'll get new numbers for July and we'll share with you guys. Overall, in the grand scheme for July, as of this report, we billed 85% of our July membership, which, you know, is an awesome number, I would say.
Yep. And just to underscore, this is Charlie again, just to underscore what Ben said, if you look at the 75% and greater band, that's 626 of our care managers and supervisors too, because there are supervisors, as we all know, that are managing a caseload. So there's 626 that have billed, or that have a caseload of 21,047 assigned to them, and they billed 19,611 with only 1,436 not billed. And as Ben said, you may have done work on the 1,436. There may have been logged activities or some work done, but they just didn't get to billing. And, you know, although our goal is 100% to be billed each month, we're very happy that in the first month, 85% was billed. And, you know, I know Ben, speaking for Ben and myself, just thank you for all of your hard work to get that done. And that's all we have, Jim and Ann.
So I just want to say, the fact that we got Venkat to say awesome job is pretty impressive to the care managers out there, because he's a hard guy to please, I got to tell you. So I just want to echo Charlie's comments. You know, in the first month, and Ann went through this in the beginning about all of the trials and tribulations, and some of which we continue to have. It's our daily drama in the day in the life. It's kind of like a soap opera to some degree, because sometimes the same things come back again that we thought were fixed, but no, it's some things never go away. But it's been tremendous. That 85%, and more than likely, as Charlie and Ben said, the numbers probably are a little bit better than that once we clear out the queue. And supposedly that issue from yesterday has been fixed. We were promised that it would have been taken care of overnight. Now, I don't know today yet whether or not we've seen evidence that it's been fixed in terms of the supervisors being able to go in and approve and audit the activities. So more to come on that. But anyways, thank you, everybody.
All right. Thank you, Venkat and Charlie. We're going to turn it over to Dr. Byron right now to give us a little bit on healthcare informed decision-making.
Hi, so this is Paul Byron. I'm the healthcare department so far for Care Design. I'm the medical director, and I'm reachable. I have a beeper on during the daytime and for immediate calls, and I'm on email for less immediate calls. We're going to go over a lot of information, that's important as we pick up and are responsible for more of the medical oversight that we do for the folks that we take care of. And I thought I'd start with this piece first, since it's easy and available. There's a booklet that's put out in 2012 by the legal department at OPWDD, and it goes over the basic information, and it's the basic information related in the 4 areas of the book: informed consent for medical issues, how to develop a healthcare proxy, how does the Healthcare Decisions Act affect us, usually related to end-of-life decision-making, and then all the forms and other ancillary things that need to be done, and a little bit of information on living wills. So, the booklet's available. There's a link to the website, right? Yep, link to the website. And there's some pieces of each of these 4 parts that I just want to mention quickly. Under the informed consent piece, one piece of critical information is that not everything medical needs what's called professional medical treatment. That's defined on page 3. That's a higher level treatment, distinguishing maybe a surgery from getting a blood draw. A blood draw, you might talk about something that's called permission to treat, as opposed to the legal necessity of getting informed consent for higher levels of medical care. On page 4, it tells you who can provide those levels of consent. And generally, we're talking here for the large portion of the population that are not able to give consent for themselves. The small portion who are able to give full informed consent for every aspect of their lives, that's not what this is about. This is about people who have limitations in their ability to give parts of informed consent for themselves at different times. There's also a difference between who lives at home with some regulations and who lives in an OPWDD certified residence. There's usually more regulations for the folks who live in OPWDD certified residences. Many of the issues are distinguished as you read through the booklet. Healthcare proxy is underused. A person who is eligible for healthcare proxy does not have to understand a lot about medical issues at all. From a legal point of view, all they have to understand is that they're getting somebody to manage their healthcare issues for them. A simple question and answer: do you understand that your sister is going to take care of your medical business if you get sick? A yes or no answer sometimes is sufficient to help develop a healthcare proxy for somebody. Healthcare proxies are very useful to people because they circumvent the sometimes burdensome legal system, paperwork system, committee system that we have to deal with for folks who don't have a healthcare proxy, especially at the end of life. So anybody who could get a healthcare proxy, no matter what their state of health is, ought to establish a healthcare proxy, hoping that they have someone who can assume that responsibility. The Healthcare Decisions Act, sometimes confusing, many times confusing, has changed a little bit over the years. There's some changes that'll still come with adding a few people to do some of the responsibilities under an end-of-life planning process. There's more explanations in the book, and I'm available if you have any questions about developing an end-of-life plan. I'm very often available for signatures on some of these forms that you need to do. Some of the forms, though, legal forms, mean that I have to interview the person before I can sign off as, say, a consulting doctor or a concurring doctor. If we can Skype things and I can have a view of that person, sometimes I can help you if you can't find docs in your local community who can provide those services for you, because there's a definition sometimes of who's able to sign off on things like one of the witnesses in a healthcare proxy who's able to sign off as the consulting doctor on surrogate decision-making paperwork. It's a limited number of people with DD experience who are able to do those kinds of things. Then lastly, you're all mostly familiar with dealing with MHLS checklists, surrogate decision-making forms, and things like that. And again, if there's any issues with dealing with those forms, you have the paperwork sitting in front of you, well, just page me and I'll call you right back. If not, just send me an email and we can talk about what to do. And there's always lots of issues related to these things. I've been here for over 20 years, and I still have to ask questions sometimes about why we do certain things, because it doesn't always make sense. So again, we'll do more issues as time comes up, but this is the introductory issue, and I'm glad to talk to any of you as time goes on. Thank you.
So he did mean pager.
Pager, is that what I said?
Well, no, you did.
Oh, pager.
But to most people out there, Paul, they're like, what's a pager?
Oh, sorry. Sorry. 20th century. 20th century. I live in a place where cell phones don't work, so if I'm home and you call me on my cell phone, you won't get me. That's very frustrating. So pagers work everywhere, and so I still live by the pager 24/7. I pretty much have it on all the time. So that's the main way to get a hold of me. I have, and I will have an official Care Design pager with another number at some point, but my current pager is useful.
I didn't put it on the
all
slide,
right,
but we can
all right.
get it out
So
again.
we'll
We
get it
have
out.
sent it
We'll
out.
get it out to everybody with how to get a hold of me.
Yeah. So you're all experts. You got that down now, right? Basically, it was just a teaser to get, so that you got some interest in this area. Helping people with healthcare proxies is something that we can do that will make a tremendous impact on people's lives, especially when they're in a medical crisis. That's not the time to develop the healthcare proxy, the ideal time. It's way in advance.
I forgot to mention, a critical issue in the healthcare proxy, remember, is the person has to be able to pick their healthcare proxy. Somebody by definition who's profoundly, severely disabled, doesn't communicate, doesn't know what's going on in their world, they cannot have a healthcare proxy. Their family cannot get or pick a healthcare proxy for them. They have to pick their own healthcare proxy, or at least acknowledge that they're going to have a healthcare proxy. So some people are not eligible to have healthcare proxies.
And they cannot pick you as an employee of Care Design New York. Now, that doesn't mean that you couldn't be a healthcare proxy for someone that you had a relationship with in a different professional capacity in the past. And many times former staff who have moved on are excellent healthcare proxies who continue to have relationships with individuals. So we'll continue to give you a lot more information on this. Dr. Byron is available. If you have a healthcare proxy and you have a question, is it drawn up appropriately? You can share that with him and he can review that. That's a very good idea because, again, too, people think they have an appropriate healthcare proxy many times when families have done it, and it is not an appropriate healthcare proxy for our population. So it really should be run by Dr. Byron, so you make sure that the family doesn't have a surprise when it's a critical time in their lives. All right, thank you very much. Much more to come on that. Job fair results. We had a tremendous job fair. I don't know, Megan, do you want to talk about the job fair? Because you were actually there for it.
So we had a job fair in Manhattan, and we had quite the flow of candidates coming in. Some with some extensive service coordination, care management experience, which was great to see. We had 38 applicants for the job fair, and we have a job fair set up for Long Island, and we are working on putting one together for Brooklyn. And we were able to have regional directors available to immediately do interviews, so that we're really trying to streamline and get the ball rolling with getting people on board. Many of the 38 will be joining the Care Design team, so that's great news. And
yay!
We saw a lot of people that came forward with based on referrals from staff. So thank you, and we really think that this is really a great way that we'll be able to increase our workforce. And some of the staff came forward and specifically said that they heard we have very good communication, which is really a great thing to hear, and that was one of the things that attracted them to wanting to come and work at Care Design. So we were very pleased to hear that.
Thank you very much. Couple odds and ends. I just couldn't fit them anywhere, so I put them here. Just to let you know, we are working on employee IDs. We have a prototype for that in the company. that we're engaging with, that we will be moving forward on them, so they will be coming out shortly. And business cards, we will have a template that we will be releasing, so that you'll be able to fill in your particular information, have your supervisor approve it, and we can get those business cards ordered for you. So we are actively working on that. A plea and reminder about setting up your voicemail on your desk and iPhones. This was asked by some of the supervisors out there for me to include. If you don't set up your iPhone and somebody calls you, they cannot leave a message because your voicemail has not been set up. Many a time when families and individuals are calling our main numbers, we don't have great information at our fingertips about if you kept your original agency phones, how to reach you that way, although we're developing that. So we very often refer them to your iPhone. If you're not utilizing your iPhone and if you have not activated your voicemail on your iPhone, that is a very frustrating proposition for families and individuals and is not looking very good in terms of us as Care Design New York universally. So please take care of that. If you need assistance with that, Google is your friend. If Google doesn't work, ask for additional assistance, and I'm sure someone can help you. Talking about assistance, I don't know if any of you have been to Litmos lately. I hadn't, and I was overwhelmed with the amount of resources that are there, overwhelmed in a good way. They are very, very practical resources, specifically about your Chromebook, on how to download the travel and expense forms, how to save documents in the cloud, how to use your calendar features, how to use Microsoft 365, how to add your signature. All of our policies are there for your viewing. There's even a video on showing you how to get access to the policies on the Chromebook. So there, information on the front door. Let's see. I think more is coming. Right now, we're going to be releasing fundamentals of OPWDD, too many Ds, care coordination and fire safety. Those will be required in August. In total, all those trainings should not take you more than 2 hours. So those, again, can fit into your schedule when they can. So there's lots of information on Litmos, and everyone needs to go there and look at what's there and use the tools that are helpful for you and your coworkers.
I think just one comment on that. What we're going to start to do is, because we continue to get emails on a lot of these topics, we're going to refer you to rather than take the time to answer you, we're going to refer you back to Litmos to kind of do your own self-policing here of the information that's there. Okay, that's why it's there.
Yeah. The other thing, if you have ideas, lots of you are tech savvy out there, or have, you might do a video. I know, you've done some videos for Lori, but if you do a video, if you see kind of the trainings and videos that are there, they're very short. It could be 2 minutes to show you how to do something on the Chromebook. If you have, if you've done a video on something that you think will be useful to the workforce, or you have ideas on what we need to put there, please share those at training@caredesignny.org. Lori asked me to do a plea. Do not ask about I-9s. Do not ask about benefits. Do not ask about salaries. Training is for training, so use that mailbox for training, because the less other items that are in there, the more they can focus on training. I do have one little thing to notice, though, that I put in red. When the last Thursday's webinar was uploaded, there was a mistake, and it was only 3 minutes long. And unbelievably, I only got that question from one person in our entire workforce, which leads me to concern that we made it very clear that these webinars are mandatory, and if you have not done them live, you need to make them up. So we only had one person, Jim, miss that webinar. Isn't that amazing? The good news is it's been fixed. The bad news is we're on to you guys. So you need to be listening to this information, because as Jim said, if you email us or call us and ask us information that we have covered already, we're not going to be happy. And it just takes away from things that we need to be focused on, not reiterating information. Now, if something we said wasn't clarified and you have a follow-up, that's entirely different. But supervisors out there, we expect that you're making sure employees are watching the videos. All right, let's want to do e-advisories a minute so I can.
Sure. So Ann is still recovering. I'm sitting next to her, so I keep worrying about getting sick. But anyway, I'm sort of freaking out on that. But anyway, all right, so here we go. So e-advisories, we really want to encourage you to sign up for e-advisories. We know that they have the former MSC e-advisories, and to get them going forward, you really need to sign up for anything that OPWDD is putting out there. So make sure you do that. Google MSC e-advisories, and the link will be the first to pop up. I guess is an easy way to get there. The Willowbrook training opportunities listed this week is not mandatory. However, you are welcome to participate. Obviously, this is something that we have to pay close attention to. And for those of you with Willowbrook caseloads, it's important that you participate as needed.
IM assessment update. The update and the advice right now is don't use it. The vendor is working on some of the challenges. Many of you had started to use it and it was locking on you and you were losing information. We don't want that frustration. It is not a Care Design New York specific issue. It is a CCO field issue, primarily with the Chromebooks, but maybe broader than that. We're not sure yet. We're kind of assessing that. And the vendor is not Metasked. It comes through Metasked, but it isn't Metasked's fault. One thing that we could put on the list.
Right. So, Ann, several of us were with Jan Abrams yesterday, and we heard that there's good news to come because they really think that they've resolved the issue. Mm-hmm. So we will let people know once that's been, fully tested and verified.
Yeah, Jim and I are skeptical. We heard that story too. But.
Yeah, I just, and again, Megan may be correct, not may be correct, it's not really Megan, but the point is, we've got to make sure this is solid before we start rolling this out and engaging with individuals and families on this, because it's frustrating, it's embarrassing to have this process initiated and then not to be able to be completed. The process is long enough as it is to go through the assessment. So we have to make sure 100% that it's working. And it can work in environments where you need to be able to connect through using a hotspot, because oftentimes that's where you're going to have to be able to do this. So we have to make sure that it is totally working, regardless of whatever device we end up using, whether it's the Chromebook to do the assessment, or as they've talked, we may be using just for the assessment, may need to use an iPad. So we're not quite there yet. And this is a problem across all of the CCOs. It is not just a Care Design issue. This is a problem across all the CCOs who are using Chromebooks, which are most of the CCOs. So we know this is frustrating. Another frustrating piece of all of this, and we know the vendor's trying to respond. And this has been 6 months in the working. Quite honestly, they've been supposedly having this close to being, ready for prime time since January, and we continue to have struggles with it. So, so until it's fully vetted, we're going to be very cautious about rolling this out until we're positive this is going to work. So you'll hear more about this in the coming days, probably.
And we'll be advocating with OPWDD to push out the deadline so that it's not so compressed. So that's another piece of this.
Yeah, and we may know that tomorrow. We have a call tomorrow with OPWDD on a host of issues. This is one of them to cover with them, and we're hopeful that there'll be some relief on when, as Ann is saying, is when the assessments. Now, it won't change when you still need to do, again, just like for July and August, the push, we still would have to do whatever the updates would need to be done. We would just say they would become an ISP meeting as opposed to a life plan meeting. So we'll let you know as soon as we have a definitive answer on that one.
Email security, lots of misconceptions out there about email security. This is when you're sending email outside the Care Design network. And if you are sending information about an individual who is served, their name, their personal information, medical information, diagnosis, specifics on them, you need to be encrypting the email. That includes going to family members, that includes going to other agencies. And you may say, why do I have to do that for the family? It's not the family, it's what happens to the email from you sending it until it gets its delivery. So it's that passageway of when it is in jeopardy. The only word that you can use is encrypt, not encrypted, not encryption, not secure, not anything else. The word encrypt has to be in the subject. Now, they have a little red box around it. You're not going to have a little red box that shows up. That's just highlighted to know that in the subject line, you need to have that word. It can be part of a sentence, it can be just the word after what you've said in the subject. So you can say other words in the subject, but encrypt has to be the word that you use. And that is very, very important. We know we have heard complaints from people who are trying to open it up, but there should be instructions on their end of the steps that they need to go through to open up the encrypted email. This is one of the things in terms of just working in our current environment of the things that we need to do. So for other agency staff, refer them to their own IT departments. For family members or individuals, if they are struggling, you can reach out to our IT resources to get some assistance on how we might help a family member.
I mean, we know this is frustrating. I get frustrated with this too when you can't open things. But, one of the things that Ann and I heard throughout our tours from the fall into before go live was the worry about information not being protected, personal information. So obviously, this is for the protection of information where your email may include some information that is considered private. So we have to make sure we're following this. So when you explain this to the individuals and families, you have to make sure you speak to that. That's the reason why this is being done this way. It's not the easiest thing. We understand that, but there is a process people have to go to get that email. It's not just trying to open it up. You actually have to register. So there's a whole process people need to go through, which, as Ann just said, tells them that when they get the email, what they need to do and how to open it. So anyway, so hang in there on that.
Privacy notices and acknowledgement forms. Lisa Getman wanted you to know that the privacy notice is available and the acknowledgement form is available on the M Drive and has been translated into numerous languages. So that is something that you should be bringing to your face-to-face visit with individuals and providing it to that individual and their families and getting the acknowledgement that they have received that privacy notice. Do not add individuals into Metasched. We cannot ask this enough. The only people who should be adding anyone into Metasched are Danielle, Megan, and perhaps the regional care managers working in collaboration with Megan and Danielle. Many individuals have been added into Metasched because care managers have been maybe frustrated because they didn't, see them adequately, and then we have duplicates, and then you're documenting on the wrong individual, and we can't delete it out, and it's creating lots and lots and we don't know who's assigned a care manager. There are numerous challenges with this. The enrollees should come over from OPWDD, and they're imported into the system, and then it has to be a very select few that are adding these individuals into Metasched. Unfortunately, we can't lock it down right now. We tried to, so that there were only certain people who could add individuals into Metasched, but that created other problems for all of you within the Metasched platform. So they had to turn it back on. So we're just asking, please get the word out and make sure people are not being added manually.
The only reason why ultimately people would be added manually is for people who are not in Medicaid, right? Everybody else will come over on the roster that we get every month, and then certain people who are non-Medicaid or private pay have to be added to the file. Again, but that is something that we check every month, and people at the highest levels will be the ones that will be updating that information in terms of the enrollees. So again, do not try to add people. If you have a private pay, that needs to be somebody new that's coming, that needs to come through Megan and Danielle before anybody gets added.
All right, a new area to our presentation, and I think my personal favorite already. We created a box for shout-outs at shout-outs at Care Design New York. I can't remember. I'm looking at Megan. She's like, oh no, we'll get that out to you again if you're not aware of it. And we've had numerous submissions, and again, these submissions are highlighting some of the great things that are going on within our organization and by the people that are employed in our organization. It's not a competition in terms of who's the best shout out. It really is acknowledging things that are going on, and many of you are doing the very same thing. So it's just to kind of give a highlight and an overview, and we want it to be fun, and we want to acknowledge people and encourage people. We have people nominated, care managers nominating supervisors, nominating care managers, VPs recognizing care managers. It goes the whole gamut in terms of who can do a shout out, and we just want to kind of highlight some of that. So we're going to run through some of the submissions that we received. Depending on the submissions, we'll have to figure out a better way. We don't want the whole hour to be shout outs, but we do want to end it on a positive note and acknowledge some. So I will start with the first one for Sarah Bosley, care manager at Mariah Center location, from Sarah Stone. Sarah went above and beyond last Friday to assure the safety of a person on her caseload who lives in the community. She had not heard from her in a couple of days, and while the person resides on their own, and does not necessarily need to be accounted for, Sarah knew this person had been going through a difficult time, made several contacts, including reaching out to her supervisor for guidance to reach the person. Sarah got in touch with another provider, and they coordinated a staff person to go and check on this individual and assure that she was safe, and she was. So kudos to Sarah.
So the next person is Jennifer Van Slyke. She's a care manager locally here, and had an issue here, which this is one that was brought to my attention previously. So this is a person that was where the sole caregiver was a mom who was being transported to the hospital. Jennifer made arrangements to bring him to the emergency respite to do an emergency respite placement. And then when she went home to help the person pack up to go to the respite center, what she found was very disturbing. And quite honestly, and made sure that the actions were put in place to ensure the health and safety of the individual. The reason why this one really caught my attention is because one of the things that Care Design has said, we really want to encourage, and actually we're requiring that the care managers, not an OPW requirement, but a Care Design requirement, to make every attempt to do at least one home visit in the course of a 12-month period. If we had been able to get into the home, we obviously would have discovered this issue much sooner, but obviously we were not in the person's home before, and what they found was not a very good environment for not only for the individual, but for the mom.
Well, and we could have been in the home, but things can deteriorate very, very rapidly too.
Yeah, that's true. That's true. But anyway, so congratulations, Jennifer, and keep up the great work.
This is from Rachel down in New York City to Luz Diaz.
Yeah, we're going to butcher your name.
Yeah, sorry.
That comes with the territory. Sorry.
For all her technical assistance with records and IT issues. Also to Amel Mohammed Whiteside for assisting with coverage, translation, and space for a new staff and to Tatiana Iaborski for translating and coverage. Also from Anna Brown to Jessica Espinal and Dione Torres for taking a very difficult and complicated case which requires delicate management.
Okay, this is to recognize Christy Campbell from Don Morse. And Christy's been working with a family to support a person, their son that recently moved in with them, and she's been putting together a whole support system that will really effectively assist him now and in the future. And she's really been amazing, and we're fortunate to have her. So thank you, Christy. And to also all the care managers on Staten Island from...
We hear them cheering right now.
From Elizabeth, we'd really like to commend them for their selflessness, teamwork, and strong work ethic throughout the sometimes very challenging transition period. And of particular note, during the checklist whirlwind, which I think is still going on a little bit, Linda Schwab, who FaceTimed a team member of the site and walked them through completing the checklist and entering them into Metasched. So creativity always wins there. So, and I actually have one more to add that is off script. I'm sorry, Ann. Ann's giving me the eye, but didn't make it into a slide, but I just want to throw it in that Carrie Woods and Tricia Chapman wanted to recognize Ellie Griffiths. Ellie sat with a new care manager from Park Place site and went through, really gave up a half of the day to go through the complicated environmental modification process, and really provided a lot of mentoring and direction that we want to make sure we're recognizing here as well.
All right, to Tina Pritchard from Jean Reynolds for all that Tina has done and is still doing for all of us. Tom, I'm not going to say I can't say your last name.
Forgardo.
Forgardo.
Got it.
From Lisa Knock. Tom has been amazing and helping all of his coworkers to use their Chromebook. And to Todd, Peter, Barb, Jeannie, and Ashley, the CDNY intake coordinators. I wanted to come up with a fancy name, but I couldn't come up with it in short notice. From Megan, thank you for all of your dedication to the individuals and families we support and rolling with all of our numerous challenges.
Oh, I'm up now.
You're
oh,
up,
sorry.
you're up, Jim.
Why don't I
Jim's
get
reading.
the big one? I'm just trying to, so Stacy Lamphere, so she wanted to give a, shout out to the 42 Daniel Street site and 66 Church Street site, which Ann and I will be getting to at some point. And our supervisor, Lisa Miller, and regional director, Carrie Wood. It's been very challenging the first month. I didn't realize that. It was a bit challenging. I thought everything went smoothly. I don't know what they're talking about.
I don't know
Anyways,
either.
yeah.
Just for them, I guess.
It took, well, this part we understand. It took an emotional toll on everyone. Sometimes we forget that in the moment with all the things going on, but we do recognize that. So, shout out to everybody there for pointing that out again to us. Things became very frustrating. People got through it. Daily frustration, daily issues, and the fact that everybody supported each other. This is just really an example of what we have seen in the first month and now 6 weeks or 40 days, as Ann said. It's just been tremendous, and it's so important to stay connected, not only within your group, but also wanting you to make sure you feel a part of Care Design New York, which we think is very important. So, and Lisa and Carrie for being supportive of everybody. That's so important that the supervisory levels are there to support the staff and help them through the challenges. So thank you, everybody.
Oh, see, she got a long one too.
This is to Alyssa and Laura at the 42 Daniel Street site from Stacy. There was a care manager who had a challenging time in the first month with Care Design. She was in Metasched a week later than all the other care managers, and then she had a family emergency where she had to leave the state for a period of time. When she came back from her family emergency, that left her about a week to get her full billing in. Alyssa and Laura stepped in, or stopped.
It should be.
Stopped what they were doing and stepped in. They stopped what they were doing on their own caseloads to assist their fellow care manager with whatever she needed. Because of the teamwork, support, and dedication that they had, this care manager was able to get her full billing in for the month of July. So thank you to Laura and Alyssa for everything that you did.
Okay, this is a shout out from Louisa to thank the 2900 Veterans Highway team in Bohemia for overcoming a number of challenges of various sorts and really staying on top of, all their work activity, checklist billing, and family needs. So thank you to everyone at that site. And then from Melissa, the overall Brooklyn regional team, and Melissa specifically references that they successfully completed over 75% of their billable activities. That was back in July 26th, and I believe that actually has gone much higher than that. And she's really recognizing the work that they put into successfully doing that, their hard work and dedication, and showing appreciation for the challenges, and they still stayed the course with that. So she wants to really recommend that entire team. So thank you to the Brooklyn Regional team.
All right, this is from Erica Stevens to Lori Liptak.
The opposite. It's to Erica.
Oh, I'm sorry, did I say it wrong? All right, to Erica from Lori.
Okay.
All right, sorry about that. For coining the phrase meta-skeletons, like skeletons in the closet, those notes that are frozen and that no one can open. So Lori appreciates that.
That's just one of the skeletons. There seems to be many skeletons in the closet here, so.
Maybe we should name them.
Exactly. Well, that's probably true.
And last but not least, from Anna Brown to the entire care management department, an overall shout out to everyone who's taken on extra cases on top of all of the other work that you have to do. I think Anna speaks for the entire leadership of Care Design New York, because you are the key to our overall success. If not for you meeting with individuals and addressing their needs and supporting them, there's nothing else for us to do here. And then we move on to congratulations. We have some congratulations to Tom Craig, who became a dad on July 29th. Courtney Saylor, who...
And we just say, I can make one comment. Yeah. Tom works here at our space, and I was wondering where Tom was, right? And not paying attention to what's my surroundings. His cubicle has all these baby things.
Pink. It's
all pink. And I'm not even thinking, Tom must be on vacation. Like, the poor guy is like, that's how blind I am. Anyway, so congratulations, Tom.
Courtney, who was just recently married on August 4th. And Don, who will be getting married on August 11th. So congratulations to all of you. And then we are questions, thoughts, advice, or final thoughts. We have 7 minutes. Okay. Oops. And Ann just made them disappear. All right. So in terms of questions, let's see what's on everybody's mind. Sorry, I can't even push it up. Okay. Can you clarify regarding Megan's email about the CAS assessors? And I lost the question, but.
Sure. I can provide further clarification. So the email that I sent a few days ago tied to us holding off on providing any personal health information and holding off on any CAS assessments that were set up with Maximus. And the reason that we are doing that is that there's a major issue around the privacy and work that has to be done with ourselves and the other CCOs and the state with Maximus to ensure that we're meeting our security and privacy requirements and that we're not, in any way not complying with that. So we will be providing more information to all of you. Many people have reached out to me to say, I have a CAS assessment scheduled for next week. What should I do? And our direction is to cancel or postpone those. And Maximus has been communicated to by us as well So they're aware of that, and they're also instructing their folks to hold off on contacting us or the other CCOs till this is resolved. And Jim, I don't know if you have anything to add?
Yeah, actually, I got a call yesterday from OPW counsel yesterday about the issue and basically indicating very clearly to them, until we have clarity from the state, meaning the Department of Health more specifically, because we are under the DOH, the Health Home Service is a DOH service. Until we have clearance from the DOH Security Bureau as to what we need to do here with Maximus. We don't know if they're considered an agent of OPWDD and that gives them clearance to do this, or is it that we have to have an agreement in place with Maximus in order to share information with them. So I reiterated to the state yesterday that it's on them to bring that to get back to all of the CCOs as to what we can do and not do, or what direction we need to be given here. So we know this is causing a big furor all over the place, and schedules, but until we have clarity, the last thing we want to do is is basically look at this as a security breach out of the gate without having the proper things in place. So I think this caught OPWDD and Maximus by surprise, because I think internally within those organizations, they were not aware of the security challenges that now, as a health home, that the agencies or the organizations face. This is different than MSC. This is a health home, and it's DOH. And the security, as you know, just from if you just look at the things we put out there already in your training, and it's going to get more intense around the ability to share information with people. So more to come on this. We will get you clarity as soon as we have it.
So, lots of things about Metasced and getting different reports out of that. I mean, those are things that we are working on, in terms of Tier 4 visits and in terms of other things. So we are actively working on that. There is a question about, do we complete incident reports if we're being notified of the incident by a residence or day program? Or only if we're initially reporting it? And the answer is yes, you do it in both cases. So if it's being reported to you, you are still documenting that. Lots of questions for Dr. Byron about giving some examples of reasons that he might be contacted. So maybe he can work on putting together some examples of where he can be very helpful to you, and we can email that out to all of you so you can see that, and we'll put his beeper number and all the contact information on that again.
And on that too, I just
great.
want to add one thing. I'd like Dr. Byron doing something over the next weeks of sessions to talk about other things that he could be of assistance to with the staff beyond the stuff we covered today.
Questions about where can I register for the Willowbrook training and when is the Willowbrook training? So I will ask, I think we had that on the slide.
I don't think it had the date of the training.
Didn't have the date,
No.
But I think it was at OPWDD,
Yeah, it's in
right?
the most recent advisory, I believe, and I think you probably have to register through SLMS. But if you go on the OPWDD website, like Ann had mentioned, if you Google the OPWDD MSC advisory and you go to the website, you can register, but you can also see the most recent advisory.
Yeah, they post all of the advisories if you haven't received it.
We can circulate the most recent advisory that has that information, but we do want everyone to get registered to get their own advisory, but we'll send that on.
Okay, somebody asked about the webinar for last week. It is loaded on Litmus. I did see it. There was a problem with it, but it is fully loaded on there now. It was corrected last night. What about POMs? Are they obsolete? No, POMs aren't obsolete, but, we are focusing on the IM assessment and life plans and all of that, so care managers really wouldn't be engaged in doing the POMs at this point, but it probably will be in your future at some point.
Yeah, and the POMs definitely are absolutely a part of the life plan and that whole structure, so the POMs are really critical, and we'll be providing more training.
But you don't have to be doing a POMS interview like you might have been doing previously for your agency. Continuing IT issues about problems with hotspots, problems with printers, please be sharing that information with your regional care managers directors so that they can advocate on your behalf. I know IT has been doing a survey form to go out to all supervisors to get additional information on how things are going and correcting spots that are having particularly difficult situations.
Right, and they've been emailing Jim directly on those. So that's actually been coming in. Of course, we only see the ones that are saying things are okay. We haven't seen the ones, Jim doesn't share the ones that, with us, I noticed, that are, things aren't so good. Anyways.
Someone's saying when they send encrypted mail to the front door mailbox, they say they don't receive it. I don't understand why they wouldn't receive that. So maybe that's something that, Danielle and Megan can test out, and work with Jim Brown if, there's a particular problem that they can't see it. OPWDD is having a real problem opening encrypted mail. Can somebody help them? No, OPWDD has their own IT department, so they can use their resources and they should be asking for assistance. I think we're about at the end. You have something else?
I just want to add in one other thing on the, somebody mentioned Tier 4s earlier. Obviously, Tier 4s, you know, the clock continues to tick. It's now into August here, and the expectation was 90 days to have plans in place. Now, obviously, with the issue, you know, with the assessment, you know, that's going to hopefully back things up, and we'll get you an answer on that. But the other issue that is the clock is ticking on is on getting to the 1-to-20 ratio. And we're also discussing that tomorrow with OPWDD and trying to get some relief from the 90 days. I don't know that we'll get that, but we will notify through the chain of command. We'll notify as we get any update as to whether or not we get any relief from the 90-day requirement of getting to the 1-to-20 ratio.
Somebody asked about wet signatures on the privacy notice. You don't need wet signatures on that. You know, you need the wet signatures on the consent forms, and there may be some Willowbrook forms that you need wet signature. I'm not going to speak to that, but you know, anything with the privacy or forms that are coming through us for intake could be scanned into Metasced, and that would be acceptable. You don't need the wet signature.
Do you want to say something about checklists?
Our home visits that are done before July 1st counted. You know, we're asking within a year. So if you did one before a year and you're kind of tracking that, we want you to be there every year and more so if people need it.
So I just want to say a quick comment on checklists. I know people have been working very, very hard and we've made a lot of progress. We still have, I believe, over 1,000 that need to get done. And I keep hearing from people that, oh, wait, these were done, we have the paper, we're trying to, you know, we need to get them into the system. Again, we really got to push the fact that those are a required element. It's required for us to, it's part of the enrollment process, and for us to be able to bill for services, you know, starting in July, we have to have the checklist done. So please definitely make it a point to work to get those done immediately. We are going to need to start voiding billing if it was done for the month of July, where we don't have in Metasced an entry that you know, specifically shows that we had a checklist completed for that person. So there will be, you know, a flurry of activity that'll have to occur. And we know that many were done ahead from back to April or May, and we really need to make sure that those are in Metasced. So please absolutely make that a priority.
And if for some reason the checklist has not been done, it needs to be completed.
Yeah.
It must be completed, because for every month it's not completed, we cannot bill for the individual. So if for some reason a checklist was not completed during the month of July, it needs to be completed as soon as possible for August.
Okay, and some IT things. People received mice and keyboards and they have nothing to plug them into. You will be getting an adapter at your sites as well. They mailed out separately, so not to worry. It's in the mail and coming.
It's like an Amazon package. You know, sometimes you get, when you order stuff, sometimes you get 2 pieces of it, and the other one comes separate. It's the same concept.
So a lot of IT things, what we will do is we will send the IT questions over to Jim Brown and his staff so that they can be aware of them and work through and hopefully respond with some Q&As out to the field on some of the IT issues, or specifically, because they'll know specifically who the questions came from. I think we're at a wrap. We're a little over 10, and we know we had a hard stop at 10. So thank you very much for everyone. Thank you for sending in your shout-outs, and hopefully we can be doing more of that and find other ways to recognize and appreciate our workforce. So
Great, thanks, everybody.